This is Jerry Hesch. I'm an orthopedic manual physical therapist, which means that I treat joints and soft tissue. And I work at Hesch Institute in Aurora, Colorado. And our website is heschinstitute.com. The last name is spelled H-E, S like Sam, C-H. And this is a demonstration of inferior traction of the TMJ. And I think that this was a technique demonstrated by John Upledger. I'm not sure, but I've been doing it forever, and it's just a very, very nice technique when you find tightness in the jaw. And what I do is I have this flexible headpiece, so I extend it back, and that puts the person's neck in extension, and it allows the jaw to relax and open slightly. Otherwise, you can place a rolled towel underneath the neck and give it a little bit of extension, and ask the client to separate their teeth slightly and then try to relax and just let that be a natural position. And it is as simple as contacting the mandible on both sides with a gentle contact, and it is a remarkably gentle technique. And all you do is simply push down ever so slightly, and you'll feel a little tiny movement, and you maintain that force for a minimum of 2 minutes. I will sometimes treat it for 5 minutes. Now you can test the jaw to see if it's tight, having them in that position with their teeth separated and relaxed, and you just lift up on the angle of the mandible with an index finger on each side. And you may find a restriction on one side, and you can also come underneath that mandible and then lift up towards the jaw, and you're testing compression. If there is a limit of rotational mobility, let's imagine I can't lift up the mandible on the left, but you can spring it on the right, and the assumption is that the mandible is a slightly side bent left. And so what you can do is separate it, going inferiorly on both sides, and then add a gentle rotation to the right. Okay? And if you feel a vertical compression on one side, perhaps you can spring the right side, but you can't spring the left, then the assumption being that the left is compressed vertically. Treatment is the same. You're going to distract both sides together and just maintain that traction, and that left side should gently release, and you might also get a little bit of gain on the right side. I hope this is helpful.